I'm joined now by David Shpilt. He's the CEO of International Cannabis Corp. David, welcome.
Thank you very much for having me.
David, in the world of cannabis, how does the International Cannabis Corp differentiate itself?
I think by virtue of our name, we've decided to step outside of the North American, particularly Canadian marketplace, and to differentiate ourselves in the high-value international emerging markets, primarily Europe.
Okay. And so your website says that you're vertically integrated on an international scale, so do you actually do everything from cultivation, extraction to formulation and product sales?
Absolutely. Let me qualify that. We are in the process, in a heavily regulated market, of standing up the business units so that we can be fully vertically integrated. The European market is regulated to medical standards, the medical marketplace only. So we have all of the necessary elements of vertical integration throughout our portfolio of assets. Now the idea is to hyper-focus them onto the medical markets in Europe.
Okay. So then you're strictly focused on medical cannabis only?
Internationally, right now, there's no adult use or recreational market like we have in Canada.
Okay.
So we are definitely focused on pharmaceutically standardized, the production of pharmaceutically standardized, premium cannabis for sale in medical markets only.
Okay, and where do you produce cannabis?
So our trading division, or our export out of Canada and import into the EU, is reliant on our ecosystem and a syndicate of Canadian licensed producers that we qualify the product under compliance with EU GMP standards, and we sell it in Germany right now. We'll be selling in Denmark and then shortly the UK.
Oh, so you export Canadian cannabis and turn it into medicine for import into Europe?
That's right. Europe is where Canada was in 2013.
Sure.
And there's no infrastructure of cultivation in Europe to support that market. So it's relying on international product. Right. And at the moment that's coming from either the Netherlands or from Canada. Cool. And until such time as there's enough infrastructure in Europe to support the domestic market, and there will be a protectionist and separationist kind of attitude and some price control. So until that time comes, we'll be importing from Canada for the next 3 to 5 years, we think.
Okay. So are you selling cannabis flower products or extracted products or a combination of everything?
That's a good question. Right now we're in dry flower markets only. They're fairly nascent, and the regulations around product standards and safety are coming into place. So we will have a derivative market consisting of medical cannabis oils, capsules, and so forth.
Cool. And so which countries in Europe, I mean, is the medical regime uniform across the whole European Union, or is it kind of like country by country there's slightly very different variations?
You know, yes, it's a good question as well. The European market is divided, the entire EU, 28 member states, has different regulations on a per country basis. I gotta start again. The EU has a country by country. The EU has a country by country framework for medical cannabis, and all regulations differ and are in different stages of development. Most frameworks are for physician oversight, physicians manage the clinical and medical management of cannabinoid therapy, and pharmacists are the distributors or the dispensing endpoints to the patients.
Okay, cool. So do you have a pre-existing sales agreement with Canadian LPs who provide your dried flower, or do you sort of buy it on a spot market basis?
We can't buy on the spot market, in that Canadian cultivated cannabis has to meet the European monograph for different standards, and our offtake agreements and long-term supply agreements, in addition to our own IP that's licensed and allows us to stream product out of Canadian licensed producers, is what we're using to sell into the European market.
Cool. So do you anticipate selling, I mean, you've got a project in New Zealand with NUBU Pharmaceuticals that you announced yesterday, I guess it was. And tell me about that arrangement. Is that arrangement sort of a typical part of your business model?
I think that that was important, and it gave us an opportunity to enter into an emerging market with a good distribution partner that was focused on advancing the medical development of that market, and our supply chain there starts in Europe using CBD finished good products, and until such time as in New Zealand the market has matured and warrants us making an investment into infrastructure, and then we'll start production and processing in New Zealand. We'll continue to expand on that international strategy of looking at good, responsible, and competent downstream distribution partners.
Okay, so is International Cannabis Corp currently making money in the cannabis space, or are you revenue positive, or where are you at in the developmental?
We're like this close.
Yeah.
Yeah, we can taste it. We're pre-revenue right now.
Okay.
But we're just putting the right things into place so that when we execute our first export, when we execute our first import into Germany and followed by the UK, we'll have a continuous, consistent supply of product. It's important to note that in a supply-constrained market like Europe, like we've had in Canada now in an adult-use market, and with different failures and regulatory hurdles on the cultivation and the grow aspect, if we believe if we can't deliver a consistent and safe, continuous product into the marketplace, we're going to do that brand a disservice,
right,
and we'll lose credibility with the stakeholders like physicians and pharmacists. So we are waiting it out until we ensure that continuity of the supply chain and all regulatory approvals are in place.
Do you have any concern that you are going to be competing head-to-head with like Canopy and Aurora? I mean, Afria, all these guys are in Europe, they're all running around getting market share. How do you break into that sort of space?
Steel sharpens steel, so we wake up real early in the morning.
Right.
We understand that we are in a quickly saturating environment with very sophisticated and well-capitalized operators.
Okay.
At the same time, we're very confident that we're certain that our IP, our know-how, and our ability to execute is just as proficient as theirs, and this is an opportunity for us to level up and into that tier 1 status and truly be an international operator, and island ourselves away from the commoditization that's going to occur in the mass production of cannabinoids and any disruption from things like biosynthesis. We own a very specific aspect of cultivation and facility design and build as well.
Cool. All right, David, let's leave it there for now. That's a great introduction to the company. We'll have you back soon. Thanks for joining me.
Thank you very much, James. Thank you.